Well, thousands of Albertans are sharing what they are calling healthcare horror stories as part of a campaign by CUPE Alberta. CUPE Alberta President Raj Appel joining us this morning. Raj, thanks for taking time for us. And I guess if we can just start with having you talk about the campaign and what kind of response you've received.
Good morning. Thank you for having us and highlighting this very key issue. We have had a very successful campaign called stateofemergency.ca. We have just over a little over 3 weeks, 25 plus thousand signatures, and 8,000 horror stories, as you mentioned. And this response has been very overwhelming, and it's very telling that this is a systemic, and people are not getting used to the 12-hour wait times. We're losing lives, and the tools that the government continues to put forward or keeps applying are not effective. We need some real solutions in public health care to save the health care.
We'll get into some of the potential solutions in a moment. What have you heard from the province in light of this response to the campaign?
We have not heard anything from the province at all, other than through the presses. We have heard the response to that they do have the tools, that they believe the solutions they have put forward, but clearly is not what the healthcare reflects at the moment.
Yeah, we did speak with the Premier, and she said they're responding to these concerns through things like Bill 11, the restructuring of the health system, and things like the nurse practitioner initiative. What kind of impact do you anticipate those efforts having? Will it help?
Absolutely not. Bill 11 is not the solution. And this is where and why you're seeing so much of Albertans and organizations speaking up and against Bill 11. Bill 11 is a privatization. We do not need to be lining private pockets. We need more investment within the public healthcare system so the health can be provided. We must protect, Canada Health Act and enforce Canada Health Act and provide care and equal care for all Albertans, regardless of the size of their pockets.
Yeah, and so specifically, Raj, if I were to sort of give you the magic wand, what would you like to see happen in the short term? What action would you like to see from the province?
We would like the province to acknowledge and declare the state of emergency so that the province can finally go into the real deals. We do recognize that the state of emergency will not solve all problems immediately, but it would allow the provincial government to work under the Alberta Health Act or the Public Health Act, and it would allow the provincial government to temporarily centralize authorities, rapidly mobilize the resources and engage in and enable expedited funding for staffing measures, which is the most rapid need, and deploy beds and equipment across the hospitals across the province for patient transfers.
Okay, we'll see if some of those things happen. Very much appreciate your time this morning. That is CUPE Alberta President Raj Appel.